Ever notice the quirky behavior of athletes in various sports? For example, soccer athletes often fake injury, while cyclists continue to pedal no matter what their injury or condition. This is not necessarily because of the toughness or character of the athletes, but because of the incentives of their respective games. In soccer, an injured athlete can win a direct kick or at least a breather, while in cycling, an athlete is penalized for every second off the bike. Proper incentives are the key to influencing behavior in sports and in healthcare, and the right incentives can be hard to align, especially with third-party payers. Learn how Intermountain Healthcare looks to properly align incentives here on Healthy Dialogues. Historically, third-party payment has made creating the right incentives in healthcare very difficult. A typical commercial transaction involves two parties, a provider and a consumer. The consumer pays all of the bill and the provider gets all of the funds. In healthcare, however, there's a triad of key players, a provider, a patient, and a payer. And this quirk in healthcare financing has had significant consequences. First, consumers are shielded from the cost of their healthcare. Because consumers only pay about 12% of the cost out of pocket, and only 28% including insurance premiums, they don't directly feel the burden of expensive or unnecessary care. The large tab is then picked up by the third-party payers, and it turns out, consumers tend to behave differently when someone else is paying the bill. Second, third-party payment leads to increased complexity. The addition of a third party doesn't make this arrangement 1/3 more complicated. It actually makes it 3 times more complicated. Instead of keeping track of one relationship, now there are 3 relationships to manage. Between the provider and the patient, the provider and the payer, and the patient and the payer. And each of these 3 parties has competing goals and incentives, making healthcare reform complex and hard to streamline. One solution to these competing incentives is an integrated health system. In this model, the provider and payer work together as part of the same system, substantially reducing the conflicting incentives of the triad. The third and final consequence of third-party payment is managed care. Managed care refers to the strategies employed by payers to compensate for the unusual incentives created by the triangle. Some of these strategies include the creation of networks for discounted fees, administrative decisions on what is approved medically necessary, and the sharing of risk, which shifts the financial risk from the payer to the provider. Population health management is a promising new approach to sharing risk. In this model, financial risk for the health of a defined set of patients is shifted to a group of providers. These providers are incentivized by outcome to improve the health of their patients. They're motivated to provide value instead of volume. Addressing the consequences of third-party payment is enormously important work, and it's at the forefront of our efforts at Intermountain Healthcare. We already function as an integrated health system with our insurance arm, Select Health, in order to reduce conflicting incentives. And we're currently implementing a transparency initiative that will provide consumers with relevant cost, quality, and patient experience data, as well as a population health management initiative that we call Shared Accountability. In order to learn more about our solutions to the challenges of third-party payment, please subscribe to the Healthy Dialogues YouTube channel.